one tax cut that they let lapse, the one tax cut they let lapse was a tax break for middle-class families to better afford health care, that premium tax credit. That's the one tax that they cut that they allowed to lapse. And so they left in place this ticking time bomb on America's health care. And the days go by one, and at the end of the year, because they left that ticking time bomb in place, it's going to explode. And the results are going to be huge increases in healthcare costs for tens and tens of millions of Americans. We know that 20 million Americans will see huge spikes. And when I say huge spikes, we're talking about, in some cases, increases of 2 to 3 times in the premiums. Average premium increases will be around 30%. That is a huge additional cost for families that are already working paycheck to paycheck and struggling to pay their bills. And so what we've said is that we want to reopen the government. I voted 7 times now to reopen the government, but without giving Donald Trump a blank check, and to diffuse that ticking time bomb that is going to go off on health care in America, because 4 million of those 20 million Americans will see such big increases that they won't be able to afford any health care. So they will drop out of the system entirely. Except when they drop out and have no health care, what we know is if they have a desperate situation, they couldn't get preventative health care because they don't have health insurance, so they have to wait until a situation becomes desperate. They go to the emergency room and they get treated there, but everybody else helps pick up the bill. So when we talk about the impact on healthcare costs in America from what Republicans are doing, they're pushing up healthcare costs for everybody here, as well as the people on the Affordable Care Act, because this is all interconnected. And again, the theme that runs through this is Donald Trump taking care of his billionaire friends and not caring about health care for Americans. He is focused on $20 billion in bailout for Argentina. He's focused on his new ballroom, taking out the East Wing of the White House and putting up a $300 million or whatever it is ballroom. This is what's on his mind. When Donald Trump promised a golden age for America, he wasn't talking about working Americans. He was talking about the people who were standing and sitting right behind him on Inauguration Day, the richest people in the world. He wants to make them even wealthier at the expense of everybody else. And that's why health care is on the chopping block in the Trump administration and this Republican Congress. But the American people, they are watching and following what's happening. And they are saying loud and clear, they do not want to see their health care costs go through the roof because of all the terrible consequences for them, their families, and their community. So thank you all for being here. As the clock ticks down, as that bomb keeps ticking on our health care, we're here to say, turn off that ticking time bomb. Make sure that we extend those tax credits so people can continue to afford health care. And then we know we have a lot more reforms that we have to make in our health care system. It is far from perfect. It needs to be fixed overall, but the thing we don't want to do is make it worse for tens and tens of millions of Americans. That's why we're here today. Thank you all for being here to say yes to health care and no to billionaire tax cuts. Let's get our priorities straight. Thank you.
What do we want? Health care. When do we want it? Now. I want everybody to take out a pen and a piece of paper. Oh, wait a minute. I want you to write down the names of the people who spoke here. And I want you to think about where they are. They're here in Washington, D.C., even though there's a government shutdown. And they're out here doing a press conference to save your health care. Now I want you to cross-check that with the names of everyone who's not here. And you'll notice that all of the speakers are from one political party. And everybody who's missing, you will not see a Republican-led press conference or where Republican members of Congress show up to talk about saving the Affordable Care Act. One of those people who's fighting in Congress for us is Congressmember Emily Randall from Washington State. Thank you so much, Emily. Thank you for being here. Thank you.
It's my pleasure.
Sorry, my name's
No, it's okay. I'm so grateful to be here with all of you today, advocates for healthcare, not just for yourselves, but for your communities. I got into politics in the first place because I know that having access to reliable healthcare saves lives. I spent my childhood with a younger sister who benefited from Medicaid. My dad worked for the Department of Defense, had good insurance. It wouldn't have covered the $10,000 a month that it cost her to eat because of a feeding tube and the equipment. It wouldn't have covered all of her surgeries and all of her wheelchairs and the inflatable vests that kept her from getting pneumonia more than 5 times a month. That radicalized me. That taught me that having access to a healthcare safety net funded by our government means the difference between life and death for families across the country. And as a state legislator, I worked arm in arm with families like mine, families of disabled loved ones, families who experienced illness and injury and who needed to rely on healthcare. We worked hard to make Washington State's healthcare system strong, to expand Medicaid. And it's all at risk because of the decisions of this Trump administration and Republicans in Congress who are rubber stamping each and every one of those decisions, who are coming back from vacation gladly to vote for permanent tax breaks for billionaires and mega corporations in July, but who refuse to set foot on this campus to negotiate a bipartisan end to the shutdown that saves healthcare for Americans, that saves 50,000 people a year from dying unnecessarily. This is moral work. This is the work that calls us to show up, to tell our stories, and to fight for our neighbors, to ensure that we have a system that recognizes the value in individual people and catches them from falling. This is the work that will protect our democracy moving forward, that will protect the health of our country. And yes, our healthcare system needs to be fixed. Yes, we have more work to do. But like Senator Van Hollen said, we cannot make it worse before we start improving it. We have to ensure that American people have access to healthcare so that parents of adult children with disabilities who are starting to get sick themselves can pay the bills, can keep a roof over their head, so that families don't have to cut their pills in half in order to afford their medication, so that folks aren't choosing between keeping the lights on as they also lose LIHEAP energy support funding and being able to go to the doctor. These are basic and fundamental decisions that allow us to stay healthy. And we are here today, and we will keep showing up every day to ensure that the Republican members who have sworn an oath to uphold the Constitution and to serve their communities, and the president and 1600 Pennsylvania Avenue know that people's health is not a negotiating tool, that we are here for the long haul to fight for the people of this country. Thank you so much.
If you notice, we have people from all over. This impacts everybody all across this country. Nobody is safe from these healthcare cuts. We have someone right now that's going to tell us about her experience with the Affordable Care Act and access to healthcare. Tamilia Casachapa from Fuerte in Arizona. Thank you so much.
I'm going to lift this up a little bit. Hi, all. My name is Tamilia Casachapa. I'm from Arizona. When I came here today, I thought about how I have less rights than my grandmother did as a woman. We have taken away our rights to be able to actually choose what we're able to do with our bodies. And I'm a single mother, and I have a child that also has a pre-existing condition as well as myself. And I think about, without access to health care, whether or not we would be able to choose to pay for our medication. My child has asthma. And with the ever-changing climate change, it doesn't get much better in Arizona. It's very hot, so having asthma in a climate like that can only exacerbate it. I'm also a former elected official down in Arizona. I was an elected official for a school board, and I think about the thousands of children that I served who also deserved access to health care, and without this type of benefit, they would also be suffering in the way that that would impact their education. My homies deserve health care, and my homies deserve happiness, and we should not be sitting here fighting for basic needs. And I really want us to take a moment to think about the type of violence that's being enacted amongst our people. This is absolutely a violent act that is happening, and it is slowly killing the people in this country. After COVID, so many people experienced health crises and medical emergencies, and to continue on this path and demolishing a way for people to actually be able to receive healthcare. We still don't know the impacts of COVID, and my family was deeply impacted by COVID. I actually almost died because of COVID and did not have access to healthcare because of how broken our healthcare system was. My child had to watch his mother suffer and almost die in a living room because we could not get to a hospital. I think about the children that had to take care of their parents when COVID was happening because their parents also did not have access to get quality health care. The teachers that had to continue teaching as they had family members that were dying during this pandemic. And that's not right. Our children, we are traumatizing them, and we absolutely do not have to. We are traumatizing our entire nation, and we don't have to. And I just want to say this. While you're building your ballroom, my body is not a dance floor for you to decide whether or not you want to actually do your damn job, so do it. And our kids deserve better. Our people deserve better. We are in a country that claims to be number one, but fails to show up for its people at every aspect, and that is not okay. We have kids here who are standing up for their right. We have kids who are trying to protect their parents because they don't want them to stress out over the different things that they have to worry about on a day-to-day basis. People can't afford groceries. They can't afford rent. They can't afford to live. It is too expensive to breathe in this country. And that is not okay. That is violent. And we need to really redefine what our concept of violence is, because this is a very violent administration. If you want a lapdog, go look somewhere else, because this perra bites back. I don't just bark. And I'm raising my kid to also bite back. And we will not sit here and lie down as these people keep doing what they're doing. So give us our health care because we deserve it, among other things. Thank you.
What do we want? Health care. When do we want it? Now. It's my honor to introduce one of the co-presidents of Public Citizen, Lisa Gilbert.
Hi, everyone. I am so inspired and moved and impressed by the elected officials who have been here with us today, by the moving personal stories that we're hearing, and the collected power of thus who is here and what we're going to do to protect our health care. I'm Lisa Gilbert, co-president of Public Citizen. For anyone who isn't familiar, we have 1 million members and supporters across the country, and we're gathered here today on the 29th day of the Republican-caused shutdown. It is so far past time for the Republicans to end the shutdown that they caused, to start negotiating, to commit to restore and improve health care for regular Americans. The impacts of the shutdown are escalating, including punitive, illegal firings of government workers, the first ever expiration of SNAP benefits, with hunger for huge swaths of Americans at stake. But Trump and congressional Republicans are still refusing to negotiate to preserve health care for millions. In fact, Republicans in Congress are refusing to come to work at all. Donald Trump and MAGA Republicans have spent the last 9 months selling out working families in order to give tax breaks to their billionaire friends. They've been illegally canceling and stealing the budgeted funds that our communities rely on. They've been aggressively and again illegally firing federal workers. And they're ignoring the fact, as we've heard over and over again here today, that when Affordable Care Act subsidies expire in just a couple days, millions of people will pay unaffordable amounts for care or they'll lose it altogether. Now we are in what is likely to become the longest government shutdown in history, all because they refuse to come to the table, they refuse to negotiate with Democrats to lower healthcare costs for all of us. We deserve a budget that meets our needs. We deserve a budget that is followed and not illegally impounded and stolen from the American people. I also want to say that this is part of a pattern. It's a pattern of disregard for the American people. As we all know, long before this shutdown, for months, President Trump and Russell Vought, the architect of Project 2025, they've already been shutting down the government little by little, firing workers, withholding funding for cancer research, and through their big ugly bill, already taking health care away from millions. We've also seen a massive, terrifying increase in authoritarian behavior generally. The administration has detained people for their political positions. They've threatened judges. They've threatened the media. They've come right at universities and nonprofits. They've militarized our cities, including D.C., without cause. They've defied our courts. And, of course, they've been defiling the power of the purse, which is what is at issue here. The Constitution gives Congress the power to appropriate. Nowhere does it give the president the power to steal our money that we need to fund the programs we depend on. So we know without a shadow of a doubt that President Trump will continue to unmake the federal government, whether we are in a shutdown or not. So we can't let this moment pass, this moment of leverage around this budget to move a budget that ensures that millions more Americans do not lose their care. So thank you all for being here, for being in the fight and protecting our health care. Thanks so much.
All right, you heard from Lisa about how there's an invasion of our cities. In addition to taking away health care, I opened up by saying that I was part of the people-powered movement to save the Affordable Care Act, the last time this administration tried to steal it from us. We would be in the halls right now telling our stories about how our kids don't have access to health care, how our parents don't have access to health care, how we can't possibly afford even the smallest increase, let alone a 300% increase to our health care. But they're all shut down. The people who control this Congress have decided to close up and go back to their districts. But there are still some here who are fighting for us, who are fighting for our communities. One of them who never shies away from a fight is Representative Chuy Garcia. It's my honor to introduce you from Illinois. Thank you.
Oops, it flew away. Thank you so much. I'm very proud to join each and every one of you fighters and advocates for health care for all our people across the land. I represent very proudly the 4th District of Illinois, an overwhelmingly working class community or series of communities, and I represent 18,000 people who stand to lose their health care or to see the cost skyrocket if the ACA tax credits expire. We can't do that. It's unconscionable. And right now, my district is under siege. Families are terrified by ICE raids, including U.S. citizens who have been targeted through racial profiling. Working people are afraid to leave their homes, to go to work, to go to school, even to go to their doctor appointments. We've spoken with clinics that are telling us that the drop-off rate is astronomical. That means people are going to be getting sicker. And now these same families are being told that their health care could be ripped away as soon as next month. Republicans are lying to the American public, and they have the audacity to even say that the shutdown is due to health care for immigrants. As an immigrant, let me speak the truth. Undocumented immigrants do not qualify for ACA tax credits in the first place. 2, while I'm telling the truth, let's also remember that immigrants pay for programs that they aren't even eligible for. In fact, they pay over $580 billion in federal, state, and local taxes to fund all types of programs and services they can't even benefit from. That's the truth. For Latinos who do qualify for the ACA, they would be among the hardest hit if the credits disappear. Nearly 1/3 of all ACA marketplace enrollees nationwide are Latino, and losing these tax credits would push coverage out of reach for almost 1 million people across the country. In Illinois, nearly half a million people, 485,000 families of all backgrounds are at risk of losing their health care, while almost 400,000 will face higher premiums. People are bracing for that. Trump and Republicans in Congress have chosen their side, and that's the tax breaks for billionaires while stealing health care from people across the country. And the sad truth is that they're stealing from all of us, including Republican-controlled states, where an overwhelmingly majority, 80%, rely on ACA. They're betraying the people that actually helped elect them to office, but we will all pay the price. They'd rather terrorize and kidnap people than to take care of people. They're wasting $170 million to buy 2 jet planes for Kristi Noem so she can run around the country and terrorize people in so many communities. Simply put, healthcare is a matter of life and death, and it's a human right. And Democrats are ready for some change. We are ready to reopen the government, protect food assistance, and lower health care for all of our people, and at the same time, save lives across the country. Thank you so much.
I'm honored to be able to introduce a leader in the fight to save health care here in the United States, Anthony Wright from Families USA.
Thank you. Good morning. I'm Anthony Wright. I'm the Executive Director of Families USA, the longtime national healthcare consumer advocacy organization. We are proud to be among so many fellow fighters in this foxhole with Popular Democracy and other partners and elected officials fighting to protect access to quality and affordable healthcare for all Americans. And together we're mobilizing our coalitions, calling our Congress members, hosting collective actions. And I want to say a special thanks to the families and people who are sharing their stories about seeing premiums skyrocket if Congress does not take action now. Because as was said, if these enhanced tax credits are not extended, over 22 million Americans will, on average, see their premiums double, in some cases more, by hundreds or even thousands of dollars. And these premium spikes are projected to push and price over 4 million Americans off of coverage, becoming uninsured, living sicker, dying younger, being one emergency away from financial ruin. So today we are urging Congress to stop the spike. Say it with me. Stop the spike. Stop the spike. Stop the spike. As advocates, we've been chanting and banging this drum for months, even years. But Republicans in Congress have repeatedly failed to act. In fact, they've been doubling down, making cuts to Medicaid and the Affordable Care Act. Cuts that harm our health care coverage, our costs, our care, and our community. Earlier this year in their big budget bill, on coverage, it would lead to over total 15 million Americans without coverage. On costs, this bill increases co-pays on Medicaid and premiums in the marketplace. On care, the cuts will lead to scale-back services and benefits and close clinics and other providers, from maternity wards to rural hospitals. And that's not to mention the specific cuts on specific communities, whether it's women and their reproductive health with the defunding of Planned Parenthood, or it's the attack on not undocumented immigrants because they're already excluded, but on legally residing immigrants, several 100,000 who would have coverage ripped away from them. The other thing is that these cuts make it harder for all of us to get on and stay on health care. And the ones that manage to stay on health care, that means we'll be left to pay more because we'll be in a risk pool that will be smaller and sicker. So these premium increases that are ticking away are the first of many impacts of President Trump's big healthcare cuts. But the key message here is that these massive premium increases are not inevitable. These spikes in healthcare costs are a policy choice by Congress and the Trump administration. So, as was stated, when Republican leadership extended tax cuts to the corporations and the wealthiest among us, they repeatedly rejected multiple amendments that would have also extended the tax credits that help low and moderate income people afford their health care coverage. So tax cuts for the wealthy, but not tax credits for low and moderate income people needing to afford their health care. And this is particularly ironic after a 2024 election that was focused on affordability, where Republican leaders are choosing to play politics and outright lie about who is impacted by these tax credits. There are millions of Americans of all races, ages, incomes, and job types that will see their premiums skyrocket. 85% of the people who get these tax credits earn less than $50,000 for an individual, or basically 5 figures for a family of 4. And those whose incomes are above are particularly the older folks, sicker folks, people with big families, and people in rural and other high-cost areas that need help so they don't have to spend more than 8.5% of their income on coverage, on premiums. The folks who rely on these tax credits are our friends and neighbors who work but don't get coverage at the job. So they are retail and restaurant workers. They are home care and healthcare workers. They are barbers and beauticians and small business owners and their workers. They're literally a quarter of all farmers and ranchers and of real estate agents. They are gig workers and independent contractors, literally Joe the plumber. So, and all of them are going to get an eye-popping bill. A young income family may see their premium double by hundreds of dollars that they don't have. A older 60-year-old couple making, say, maybe $90,000, $40,000 for each of them, in Maine or Wisconsin or Washington, they may see their premiums go up by $10,000 a year, $17,000 a year, $20,000 a year. So the urgency of this is now. Open enrollment starts this Saturday, November 1. Millions of Americans will see their premiums go up. And how can anybody make a choice for coverage when they don't even know what they'll be paying? And if that payment is not just a couple of dollars different, but hundreds or thousands of dollars difference. And so this isn't a January problem. This isn't a December problem. This is a now problem. Every day they delay is a day that the rates are baked in and make it harder to undo. Every day they delay is a day that more people see the spike and get sticker shock and fall off of coverage. Even if Congress fixes this in December, the Congressional Budget Office estimates that 1.5 million people will lose coverage just because of the shock of seeing that big increase and just falling off, and we won't get them back again. So that's why, even before these notices, the cost of healthcare has been the top issue for voters on both sides of the aisle, and the overwhelming majority of Americans want Congress to do something about it. Extending these tax credits should be the easiest vote in the world and an entry point for an actual affordability agenda to take on the health industry, to address why healthcare is so damn expensive to begin with. But the first job is to stop the spike. Stop the spike. Stop the spike. Enough is enough. It's time to stop playing politics. It's time for Congress to get back to work and get Americans to work on health care that everybody can afford. Thank you.
Anthony mentioned that this is a full-on assault on our healthcare system. This means that you might face $10,000 more in your bill, and I really want you to think, could you afford that? I know I couldn't afford that. It is also coming on the heels of attacks on our reproductive health in this country. And I'm honored to welcome up Neda Ashtari, who is a doctor, a primary care physician from Planned Parenthood Action Fund and a former patient of Planned Parenthood. Thank you so much.
Hi, I'm here today not as a doctor or an advocate, but as someone who knows firsthand what it's like to need care and to go without it. As someone who sat in the waiting room of a Planned Parenthood in Los Angeles, the only place that had its doors open to me when every other avenue for care was closed. I was a teenager on Medi-Cal, which is California's Medicaid program. And what that meant at the time was that I had insurance on paper, but in reality, I didn't have any access to care. I had a list of disconnected phone numbers, full voicemail boxes, and clinics that told me to call back in 3 months if they picked up at all. And after a while, you just give up. So I learned to go without care and hope that nothing went wrong. But when I needed birth control, I just couldn't wait anymore. So I went to a Planned Parenthood, and everything was different. They saw me without delay. They accepted my Medi-Cal. There was no paperwork maze, no months-long queue. And when I left that day, I got a lot more than a prescription. I left with control, the ability to focus on my studies, the security of knowing that I was able to pursue my dream of becoming a doctor, and the power to shape my own path without being one crisis away from falling off of it. So a few years later, when I needed care again, I went to Planned Parenthood knowing that its doors would be open. This time I went for a pap smear, which is a routine exam, 10 minutes for most people. But for me, it wasn't routine at all, because I knew what it meant to go without preventive care and to find out too late. My mom was denied health insurance before the ACA, and that meant years of going without the tests that could have detected the mass growing in her breast early on. By the time we caught her cancer, it had spread to her liver, her bones, and her entire body. So when I was at the Planned Parenthood on the exam table that day, I was doing a lot more than getting a screening test. I was taking control of my health before I had to fight for my life. Planned Parenthood and health insurance made that possible. Today, that is under attack. President Trump and Republicans in Congress are taking away access to the life-saving care that people like me depend on. And today, we have the opportunity to stand up, to speak out, to show up, and to demand that our leaders do more to protect our care, and our lives literally depend on it. Thank you.
Remember when, in the debate, when President Trump said that he's got some idea of a plan, I forget the exact word, sketches of a plan, concepts of a plan, that's what it was. Well, I have some breaking news. We have the plan right here. It's billionaires get richer and Americans get sicker. So, and I'm very honored to introduce up here Anna Aurelio, who is the Senior Director of Campaigns for Economic Security Project, who also made these great signs. Thank you.
Am I last? Oh, okay. Hi, good morning, and thanks to everyone for being here. My name is Anna Aurelio, and I'm with the Economic Security Project. Our mission is to build economic power for all Americans, and we believe that everyone should have the freedom and economic stability they need to thrive. But that's not what's happening today. The price of everything is up. The price of food, the price of healthcare, the price of housing, the price of electricity. And this administration is making it worse. In fact, the billionaires' banks' accounts are up, but the only thing that's come down is the East Wing of the White House. So Americans need better and more affordable health care, not massive cuts and higher costs, and especially not to pay for tax cuts for billionaires. Let's hold up the signs that say, billionaires got richer and Americans get sicker because of the Republican and Donald Trump's action. Say it with me. Billionaires got richer, Americans get sicker. That's the outcome of that. So what are we going to do about it? We need to stop the healthcare heist. Republicans are lying about the impacts of their actions. And in 4 short days, 22 million Americans will have the receipts. That's the start of open enrollment. People are facing skyrocketing health care premiums. And 5 million Americans could lose their health care coverage as a result. It's time for Republicans to stop the health care heist, come back to D.C., extend the health care tax credits, and everyone can do their part. When you see your premium notice, you get your premium notice, black out your name, black out your address, post it on the internet, send it to your member of Congress. Stop the health care heist. Thank you so much.
Thank you. Stop the healthcare heist. Stop the healthcare heist. Stop the healthcare heist. Keep going. Stop the healthcare heist. I got you. All right. Anthony talked about who is going to be impacted by this. All of the people who are working, your barber, literally Joe the plumber. Also consultants. If you remember the first time, the first few weeks of the Trump administration, before they destroyed the East Wing of the White House, they actually took the letters off of a building, USAID, and by shutting down that building, they took away health care for people in other countries. They also took jobs away from thousands of people in this country. And that meant that they no longer had employer-provided health insurance, and they had to go find it on the Affordable Care Act. We're going to hear from somebody who was impacted by those cuts and who is facing a dramatic increase to their Affordable Care Act bill. Courtney Pompey from Virginia. Thank you so much, Courtney.
Hi, everyone. Let me get up my notes. So my name is Courtney Pompey. I live in Alexandria, Virginia. On January 27th, 2025, I lost my job at a nonprofit that carried out the work on behalf of the U.S. government and USAID in particular. Projects that were designed to make America more safe, secure, and more prosperous. I have 25 years of expertise in democracy, good governance, human rights work abroad. When my HR director called me into her office on the 27th of January to inform me that my position was being terminated, it was 4:30 p.m. I lost my health care at 5 p.m. when the office closed. I didn't know that for several days. My only recourse was to turn to the ACA and the Virginia Healthcare Marketplace to secure a basic healthcare plan. I'm increasingly concerned about what the Republicans are doing with our health care and the elimination of tax credits, subsidies, and reasonable premiums. I may lose my coverage again when the current policies and threats with a government shutdown. With the current plan, my health care insurance premium is slated to increase by more than 60%. I spent 25 years implementing democracy programs abroad, 25 years in service of the American people. A day has not gone by that I have not looked and applied for jobs. In 10 months, I've only had 3 interviews. I was lucky enough to secure 2 part-time minimum wage jobs. They don't provide health care. To be clear, I can work a full 40-hour work week at the wages that I'm earning now, and they will not be enough to cover 1 month of my insurance premium at the rate that it is slated to go up for in 2026. My father passed away of COVID in 2021, and my mother, my senior mother, now lives with me. She's on Medicare and on Social Security. We will not be able to afford to live with what is about to take place if the government does not come back, open up, and take care of the interest of the average American citizen. We need Congress to come back to work. It's paramount, as all of my new friends have also explained. This impacts everybody all across the country. Our Congresspeople, senators, House of Representatives are not only here to serve the people in their constituencies, but they're here to serve all Americans, and I urge them to come back, protect health care for all Americans. Thank you.
Thank you so much, Courtney. I'm pleased to be able to introduce Fawn Holdridge from SEIU 668, who is a member of that healthcare union. Thank you. Thanks so much, Fawn.
Hello, my name is Fawn Holdridge, and I am a member of SEI Local 668, and I work as a public sector worker in Pennsylvania, where I determine eligibility for SNAP benefits. Some people, when someone applies for SNAP benefits, I review their eligibility and speak with them on the phone to confirm it. I am a frontline public sector worker who connects families with benefits. I speak with single moms who are working 2 part-time jobs, moms and dads who both work, individuals with disabilities who are unable to work a part-time job, and senior citizens, all people who qualify for nutritious assistance because they meet the guidelines. With this in mind, it is especially difficult that the SNAP benefits will not be issued in November due to the government shutdown. My coworkers and I will have to tell families who are eligible do not qualify to receive their benefits because of this. As a worker, all I can do is direct them to food banks. How long will those same food banks and nonprofits need to turn people away because they do not have enough resources to assist everyone who is in need? Because of this situation, I am deeply concerned for my clients and coworkers. People will become desperate through no fault of their own, that they cannot afford food for their families. This desperation will pose potential safety risk to workers and visitors in our offices. These issues are closer to home than many realize. Most people are only a few steps away from needing SNAP or Medicaid. It only takes one loss of job or an accident for a family to need assistance. These are the stories I hear every day. Food security and health care are closely linked. They go hand in hand. When people cannot afford food, they risk becoming sick and needing hospital care. The lack of access to proper nutrition will only worsen existing health care conditions. My husband lost his job during COVID. He relied on the Affordable Care Act for health insurance. I was working, and the insurance premiums from my employer were too high for him to be covered under my plan. If he did not have the insurance through the ACA, there was no way he would be able to go see a doctor if he got sick. If the premiums had risen back then to what they're about to go, we would not have been able to afford the ACA premiums. Given all of this, I urge the federal government to act immediately and release the November SNAP benefits to ensure that no eligible family is left without food during the shutdown. Public sector workers and the public must not be put at risk. We need to make sure that health care costs do not rise. We need bipartisan negotiation to end the shutdown and lower health care costs. We say this is the greatest nation, and it's definitely time to act like it. A great nation does not leave people starve and go without health care. Thank you.
Stop the spike! Stop the spike! Stop the spike! As Anthony said, this is a now problem. We demand that Congress comes back. This impacts and does something to stop these dramatic increases to the Affordable Care Act and saves our health care. These are our last 2 speakers. This impacts patients, but also people who work in the healthcare system. I'm honored to introduce Brianna Washington and Akeem George from the Committee of Intern and Residents. Thank you so much. Thank you.
Hello, everyone. Hello. My name is Dr. Brianna Washington, and I'm a psychiatry resident at a community hospital and a delegate for the Committee of Interns and Residents. I'm currently working here in the district. I'm a wife. I am a caretaker for my mother and a new mother myself, and I'm here to speak for my patients and their access to health care. As a psychiatrist, I have seen how mental health has gained more popularity over the last couple of years, but these cuts will drastically limit people's access to mental health when they need it now more than ever before. With higher premiums, some of our patients will be forced to choose between paying for a medical procedure versus seeking mental health. Emergency rooms will see more acute mental health crises as patients go untreated. This will cost the country more money, overwhelm the already overfilled emergency rooms, and worsen patient outcomes. What am I supposed to say to my patient who's contemplating suicide because they do not know how to pay for their medical bills? If people can't get their medication through medical providers, they may look to self-medicate by buying pills off the street or numbing themselves with alcohol. This will lead to more addiction and more overdose. We also know that underserved populations will see the biggest impact. These cuts will make the hole in our safety net hospitals bigger and bigger. If we're not there to help our patients, our communities, who's going to step in? It's time to tell Republicans to stop playing political games and to keep their hands off of our health care. We demand that Congress protect our health care. It's almost Halloween. I've taken off my mask to talk with you today, and it's time for Republicans to take your mask off. We are not afraid of you. We won't stop fighting for health care for our patients and for our communities. Thank you.
Hey everyone, I'm Dr. Akeem George. I'm a pediatric resident physician and proud member of CIR SEIU. And I'm here to talk about why it's so important for Congress to protect nutrition benefits like SNAP and WIC, as well as the Affordable Care Act for the safety of my patients. This fight is very close to home for me because I grew up with family members who received food stamps and have family members that still use benefits like SNAP to this day. These are folks who are taking care of kids with developmental disabilities and couples taking off from work to care for dying parents. And without these benefits, they risk losing their homes because they decided to go and stay with family and take care of family that are in need. And every day at work, I see the benefits that these nutrition benefits like WIC and SNAP provide for my patients. Without the burden of knowing when their next meal will come, kids can engage more with school. They can look forward to joining sports teams and building the skills that they need to become strong members of the community as they grow up. And if these benefits were to expire, I would see more babies in the hospital with cheeks that are too small to pinch because their parents were forced to ration formula in order to keep a roof over their heads. More kids would show up to school hungry, irritable, and unable to focus on their learning and their growth. And all of these problems become even worse if the cost of insurance premiums skyrocket. Some of the families that I take care of will have to decide between paying $300 for specialized formula or the extra $200 a month that their insurance premiums will go up. And this is already on top of the already unaffordable cost of living that we all face. Families deserve to have affordable access to health care so that they can help their kids stay engaged, learning how to be the best versions of themselves. Missing out on coverage puts so many communities at risk of breaking down because more kids will end up in hospitals and miss out on the joys of childhood, and more parents will miss time from work to take care of the children who are supposed to be the future of our country. The kids are supposed to be the ones at home playing games, not Congress. So please stop playing political games with the care that keeps our community strong and our kids healthy. If these subsidies lapse, I fear my patients' health will get worse, and it'll make it harder for us to care for all of these patients. So let's please protect the ACA, and let's not let kids go hungry so the richest among us can pay for bigger and better ballrooms. Please protect our health care.
Thank you, Dr. Washington and Dr. George. George Washington. Okay. So that's it. Let's end with a chant. Save the ACA, affordable health care now. Save the ACA, affordable health care now. Thank you so much.